talk about high output heart failure. So I'm going to draw a simplified diagram of the heart. Separate down the middle, we'll call this the right side, we'll call this the left side. We'll draw a simplified representation of the arterial system, we'll call it A. C will represent the capillary bed, and then we'll return to the right side of the heart via the venous system. So high output heart failure, we'll just call it HO heart, call it HF. So high output heart failure is primarily a problem with the systemic vascular resistance being too low. And that systemic, all that means is is how much resistance the blood has to encounter when it flows through the arterial system. And what disease states can cause a reduced systemic vascular resistance? This can be liver disease, especially cirrhosis. It can be in anemia, really severe anemia. It can be in high thyroid output states like thyrotoxicosis. And you can also see it in, so there's certain disease states where normally blood has to pass through this high resistance capillary bed. So the capillary bed normally provides a source of high resistance. Now, what condition or what state can cause blood to bypass this capillary state? So from the arterial system straight to the venous system over here. Well, if there's some sort of a shunt or if there's a fistula. So if you have an arterial venous fistula, so say you've got a patient who's on dialysis or they've had some kind of traumatic injury, car accident where the fistula is made pathologically and not man-made like it would be in someone going for dialysis, or even in dialysis, that blood can go straight across from the arterial system to the venous system, bypassing this high resistance state and then going back to the right ventricle. And what's the problem with this? So when blood returns too quickly to the heart, and then it will go from the right ventricle and it will eventually return to the left ventricle via the lungs. We'll put the lungs here essentially. So it will eventually return to the left side. But the problem is that blood returns too quickly to the left side, and the left ventricle, the cardiac output of the left ventricle is not enough to keep up with the blood returning to the left side of the heart. And what happens when the left ventricle cannot pump out enough blood that's returning to it? Well, the blood has to go somewhere, and where does it go? Straight back to the lungs. And what kind of symptoms do we get when we have volume or fluid in the lungs? Well, we will start to get reduced oxygen saturations. You can start getting all the typical symptoms of pulmonary congestion. You can get pulmonary edema, call it pulm edema. You can get effusions, just like you would in any other form of heart failure. You can get shortness of breath and all the classic signs of pulmonary congestion. And that's primarily a problem due to blood returning too quickly to the left side of the heart. And as we'll just go through the conditions again, it's like liver disease, anemia, thyrotoxicosis, arterial venous fistula, and there's plenty of other conditions as well, which I've not named here. So that's it, guys. Simply explained, high output heart failure. What you have is the systemic vascular resistance is reduced. Blood returns back to the right side of the heart and the left side too quickly. Left ventricle is unable to keep up, and you get the backup of blood into the lungs, which causes all your classic symptoms. And how do you treat this? Well, you just got to treat the underlying cause. So if you're anemia, you treat the anemia. If you've got thyrotoxicosis, you treat that with the usual medications. So you can get beta blockade and treating the underlying cause of the thyrotoxicosis with antithyroid medicines. One more disease I forgot to put is Paget's disease, and this sometimes comes up in your question. So Paget's disease of the bone, you have this disordered osteoblastic and osteoclastic formation in the bone, which essentially means that you have these abnormal connections between you have this low resistance flow state throughout the bone, which almost acts like an AV fistula and really shifts blood back to the heart quickly. I hope this was useful, guys. Like and subscribe. I'll make some more videos explaining concepts